Welcome to Choodle Sketches by Sir Choobie, where faith is learned, understood, and deepened in simple ways. Let's get started. In a world of complex medical choices, where life, death, intention, and consequence often intertwine, how do we determine what is morally permissible when an action has both good and bad effects? This is the very heart of today's discussion. The principle of double effect offers a lens of moral clarity when the lines seem blurred. And yes, it's more relevant than ever. The principle of double effect originates from the moral theology of St. Thomas Aquinas. It refers to situations where a single action can produce two effects, one intended and morally good, the other unintended but foreseen and possibly harmful. Four conditions from the principle help ensure that our actions remain morally good, even when unintended harm might occur. 1. The action itself must be morally good or neutral. 2. The good effect must not be achieved by means of the bad effect. 3. The intention must be to achieve only the good effect. And 4. There must be a proportionately grave reason to permit the bad effect. Example number 1. Palliative sedation. A terminally ill patient suffers from excruciating pain. A doctor administers high doses of morphine to alleviate that suffering. However, it may also hasten death by depressing respiration. The doctor's intent is to relieve pain, not to cause death. If all conditions are met, this is a morally permissible application of the principle of double effect. Imagine a pregnant woman diagnosed with uterine cancer. The only way to save her life is to remove the cancerous uterus, which will unfortunately result in the death of the unborn child. Again, the action, the removal of the uterus, is not evil in itself. The intention is to treat the cancer, not to kill the child. The loss of the unborn life, while tragic, is a foreseen but unintended consequence. The principle of double effect helps healthcare providers, ethicists, and families navigate morally complex scenarios, especially in end-of-life care, reproductive health, and emergency medicine. It safeguards human dignity by ensuring that intentionality matters in ethics, and it urges us to act with prudence, compassion, and moral coherence in every decision. In a world where intentions matter just as much as outcomes, the principle of double effect reminds us that doing good must never be confused with doing harm. So the next time you face a difficult bioethical dilemma, ask, what is intended, what is foreseen, and what is morally right? This is Sir Choobie, inviting you to think deeply, act wisely, and always choose compassion as your compass.